So next up, House File 1158, Representative Acomb. And Representative Acomb is going to move. Let's see, Representative Acomb, are you on the committee?
Nope, I'm not on the committee, but I'm here.
You're on the, okay, you're not on the committee there, okay. It's too many of these little boxes floating around. So the chair will move on behalf of Representative Acomb that House File 1158 be laid over for possible inclusion in the finance bill. So Representative Acomb, to your bill.
Thank you, Madam Chair and members of the Health, Finance and Policy Committee. I am here today to present House File 1158, which is a bipartisan bill requiring a temperature monitor for some prescription drugs that are delivered by mail. For many reasons, ranging from convenience to necessity, some medications have started to be delivered by mail rather than the traditional method of being picked up at a local pharmacy. This bill is focused on this change in delivery and stems from my family experience. As some of you may know, my husband lives with multiple sclerosis, and to treat the disease over the years, he's been prescribed several specialty medications. These specialty drugs are often very expensive, sometimes costing tens of thousands of dollars per month. Because these drugs are not widely used, the industry has gone to a direct mailing model for delivery. An issue with this delivery model is that many of these medications have temperature requirements for their stability and efficacy. Throughout the shipping and delivery process in a state like ours, these drugs can be exposed to such a wide range of temperatures. Patients who depend on these prescriptions have no way of knowing if their medications have been damaged by temperature exposure and whether they remain 100% effective. The remedy is an inexpensive temperature tag that can be included in the packaging that will show if it has been exposed to extreme heat or extreme cold. These tags can cost as little as $1 and are well worth the investment by the shipping pharmacy to ensure that critical and expensive medications are protected. This would give the confidence customers deserve that the medications that have been prescribed to help them is able to give them the full benefit possible. As I considered this bill, I consulted with Dr. Cody Wiberg, who's the Executive Director of the Minnesota Board of Pharmacy, and he is here today to testify on the bill.
All right, thank you, Representative Acomb. Dr. Wiberg, welcome.
Good afternoon, Madam Chair, members of the committee. I'm Dr. Cody Wiberg. I'm the Executive Director of the Minnesota Board of Pharmacy. And yeah, technically, I can't say that the board members would approve this bill because the board members have not considered this specific bill yet. They'll do that at the March meeting. But what I can say is the board has addressed this issue over quite some time because we do get complaints from citizens, both in the summer and the winter, that says that their products have been rendered unusable by exposure to temperature extremes. So what I can tell you is I do think that if this does go before the board, I think that they're going to support it based on what we've done in the past, which is we actually adopted a rule in 2011 that goes not quite as far as Representative Acomb's bill does, but we already have a rule in place that says when medications are delivered, the pharmacy is supposed to use, it says, appropriate packaging and devices as required by the manufacturer or recommended by the manufacturer or the United States Pharmacopoeia. The one difference between our rule and Representative Acomb's bill is our rule has this little caveat that says, in the professional judgment of the pharmacist. So in theory, a pharmacist could say, well, I don't think that I really need to do that device, whereas Representative Acomb's bill does go beyond that and says an inappropriate device needs to be in the packaging. And, but based on the fact that the board has gotten complaints, that the board went as far as to adopt the rule that I mentioned, I do believe that when I get to put this before the board at one of its public meetings and ask the board members whether or not they support the bill, I do believe that a majority of the members will probably support the bill.
All right, well, thank you, Dr. Wiberg. We appreciate that. And if you could just hang around in case we have any questions from members, it'd be great. Next, we have Michelle Mack. Welcome.
Good afternoon, Chair Liebling and members of the committee. My name is Michelle Mack, and I'm a director at the Pharmaceutical Care Management Association, PCMA. PCMA represents America's PBMs, or pharmacy benefit managers. PCMA appreciates the opportunity to testify in House File 1158. For PCMA and its member companies, the safety and efficacy of mailed prescriptions is of utmost importance and is well reflected in the level of precision and planning undertaken by mail service pharmacies in the mailing of prescription drugs, including those with special handling requirements such as hemophilia, HIV, and cystic fibrosis medications. We appreciate Representative Acomb bringing this bill forward, and we look forward to working with her on the language and getting a better understanding of the bill's intention. I know that Dr. Wiberg had spoken to us previous or right before I'm testifying here, but I just wanted to bring some concerns that we have on the bill because we're just trying to seek some clarification on how wide of the scope that this bill impacts. We're wondering if it's just focusing on a particular segment of pharmacies, and we'd like to understand the reasoning. Also, the path of the prescription drug from manufacturer to patient involves a lot of entities other than a pharmacy, such as manufacturers and drug wholesalers. So we have questions about how those non-pharmacy segments in the supply chain fit into this bill. And then I guess the other question is we were seeking information on the reasoning why this is being put into statute and not done via board rules. As I previously stated, while we do have concerns and questions, we do look forward to working with Representative Acomb on this bill further. Thank you for your time and consideration, and I'd be happy to answer any questions.
All right, well, thank you, Ms. Mack. And, just to say this bill has been around for a while, even though we didn't give it a hearing. So, I hope that you will connect with the author and have some conversation. I do have a question for you, Ms. Mack, while we wait to see if other members have questions. And that is, if I am sent a drug that is temperature sensitive, and say it's a drug that needs to stay cold, and I get the drug and it isn't, well, it could or could not be cold, and I open up my drug, how am I as a consumer supposed to know whether that drug has lost its efficacy because of temperature fluctuation?
So, Chair Liebling, all of the mail order pharmacies and specialty pharmacies have very high-tech and complex software systems. A lot of them, what they'll do is they will look at the temperature before they even package the drug. They look at the temperature of where it's coming from and then where it's going to. And depending upon that temperature will depend on the size of the package, what kind of ice packs go into it. And it is guaranteed, they will look at it and it will be, they will give it a couple days as well. So, and if there's any questions, there's always someone for the patient to call if they have questions about it.
Well, Ms. Mack, as a consumer, how would I even know whether to have a question? I mean, I think your answer is we do our best, so trust us that we did our best. And as I'm understanding Representative Acomb's bill, this is the consumer is possibly paying thousands of dollars for this drug, and yet they have no way of knowing that it arrived at the temperature or that it's been maintained at the temperature that it needs to be to have any efficacy. So they could be taking a drug that doesn't work, that they've paid thousands of dollars for through no fault of their own, and they have no even way of knowing. So Representative Acomb, I'll turn it back to you, but these are the questions that it raises for me. And I have to say that your answer didn't address that. So, and then I do have some other members. Representative Acomb, do you want to comment?
Well, thank you, Madam Chair. And I think that the point that you made is a very good one, that as the system sits right now, the onus is on the consumer to prove that something has happened when they have no way of being able to tell that when it's delivered to them. And so I think my bill is aimed to to protect the consumer who deserves to get the most effective medication that they can. And so I appreciate there were questions about rulemaking versus legislation. And I think that, frankly, we can handle it either way effectively. And so my choice is to do it legislatively. And I do hope that Ms. Mack and I can have a chance to talk after the hearing. I apologize that my schedule was so busy today, but I certainly would be happy to talk to you about your other questions.
All right, Ms. Mack, go ahead.
Chair Liebling, I just wanted to comment. Not only, I know the patients are spending lots of money on this, but our clients who are insurers and employers are also spending lots of money. So, I mean, we need to guarantee that what the patient gets is not only safe, but it has the efficacy that it needs. So I just wanted to add that.
Right, thank you for that. And it just seems to me that Representative Acomb has a really good idea for you there. Representative Munson.
Thank you, Madam Chair, and I apologize for the bad audio, but my question is to the bill's author. I like this bill for, I know there's been issues with certain drugs, but especially for consumers that are using mail order pharmacies, where you come home and there's a package on your front step in sub-zero weather or in 100-degree weather. I don't know, as far as like pills and stuff, if there is a maximum temperature for pills. If it's, it has to be kept below 120 degrees. Does that mean that we're going to require these devices to be in really every package of every prescription drug, or is it only on liquid stuff, or just a certain series of drugs? And maybe that question was already asked, but and then the other issue is, if it's not just for the ship directly to consumer drugs, does this also require it when it's being shipped from the manufacturer to the wholesaler? And then if it goes in 10 different directions, does that 10 additional devices that have to be added to each box?
Representative Acomb.
Thank you, Madam Chair and Representative Munson. And I'll start with your last question first. I think that under Minnesota law, we can only impact those things that are within our state. And Dr. Wiberg can correct me if I'm wrong, but it's my understanding that those interactions or transactions between manufacturer to others outside of our state, we can't impact under commerce clauses. And it looks like Mr. Wiberg has turned on his video, so let's let him fill in my gaps.
Dr. Wiberg.
Madam Chair, Representatives, yes, I have not figured out how to raise my hand on Zoom yet, so I turned on my video, hoping to be recognized. That is very possibly correct. One concern that I would have is if we put into state law a requirement that affected the distribution of drugs between manufacturers and wholesalers, much of that distribution would happen entirely outside of the state. And there could be a challenge for that. But the other thing is, in providing technical assistance to Representative Acomb, I just looked into this a little bit, and the FDA inspects manufacturers and regulates manufacturers, and they will, states and the FDA both regulate wholesalers, and they are actually very much in tune to the need in the whole distribution chain to keep medications at the right environmental conditions. To answer, if I could, Representative Munson's question, the way that the bill is written, it basically would require the pharmacy to follow the recommendations of the manufacturer or USP. So for most solid oral dosage forms that aren't something like a gel cap, you're not going to see recommendations to have these sort of monitoring devices in it. This is primarily going to affect refrigerated products or other products where temperature extremes could really make a difference to the efficacy of the product.
Thank you, Dr. Wiberg. Representative Acomb.
Madam Chair, if I may, and I will only say that from my husband just recently was sent some medication. It is in pill form, and it is intended to be kept at room temperature. and it had sat out it had been brought to Minnesota and it had been on a truck for days when it was sub-zero and didn't get above zero even during the day. And so actually that was one of those times when he was able to call, talked to the manufacturer, and it wasn't easy to find out what the temperature guidelines were supposed to be or the range that they were in, but he did get them to send him a new prescription. And so it isn't just liquid like we are. I mean, we're all pretty familiar right now with the vaccine and the extreme cold that needs to be kept at, but I do think it goes into pill form as well as liquid and other kinds of medication.
Okay, Representative Bahner.
Thank you, Madam Chair, and Representative Acomb. And I think, Representative Acomb, you mentioned that this device that we're discussing here costs around $1. Is that correct?
Representative Acomb. Yeah.
Thank you, Madam Chair. Yeah, I think there's different types of devices. I think they can range in price. I think the least expensive is about $1. And then I think actually another lobbyist reached out to me and we connected by phone yesterday or the day before, and she said they can range in price up to $35 or something, which are a little bit more precise than the less expensive one, but there's a range, I think. At least that's what I've been told.
Representative Bahner.
Thank you. And I guess, here's the thing, we talk a lot about, and I think as legislators, we have a really large focus on sort of that people-centered care for our citizens. And I guess my curiosity here is if we can put a device that ensures that security for a consumer for as little as $1 on a prescription that costs several $1,000s. It seems like a really small cost of doing business. And I'm struggling here a little bit with the earlier testimony on this issue and the resistance to looking into this option, because it seems like such a small item. And, when we factor in the full cost of doing business, it seems silly not to be giving patients that peace of mind for such a low price point.
All right, thank you, Representative Bahner. Representative Munson.
Thank you, Madam Chair. And I just had one more follow-up question because I like the bill, but as we've been talking about this, and I'm worried about the mail order pharmacies, which have been traditionally the least expensive option for so many people. I would hate to see prescriptions, online posted saying that they're available in all states except Minnesota because they can't, this mail order pharmacy that's out of state doesn't ship with these devices because we're the only state that would have this. So I'm reluctant to vote for this bill, but I'd like to just get input and make sure that this would apply to out-of-state pharmacies sending it to here, or would that also violate the interstate commerce clause? If anybody could answer that.
And just to clarify, Representative Munson, before we get the answer, we're not voting on it today. It's going to be laid over, but Representative Wiberg, I'm sorry, Dr. Wiberg, do you want to take that one?
Never will I be Representative Wiberg. Anyway, the difference here is that traditionally the federal government, the FDA, regulates product, but states regulate health professions under the 10th Amendment to the Constitution. And so the Board of Pharmacy has been empowered by the legislature to do that regulation. And so, yes, we can, in fact, enforce a law like this against out-of-state pharmacies. Every pharmacy that ships into Minnesota needs to be licensed by the board. And for a statute like this, we would expect that to be followed. There are certain circumstances when everything is happening within the other state where we would defer to that state's Board of Pharmacy because that's all happening there. But when it comes to actually shipping the product in and having a statute like this, we would say, yes, this is what the law says. So yes, this is what you have to do. An analogy to this, if you will, or a similar situation is that out-of-state pharmacies that dispense controlled substance prescriptions to Minnesota residents, they do have to report to the Minnesota Prescription Monitoring Program those prescriptions.
Thank you, Dr. Wiberg. Not representative. We won't promote you just yet. Any other questions or comments from members? So I have another one, since I think we have just a bit of time here, and I don't know if this is for Representative Acomb or maybe from Ms. Mack, but you know, suppose you do have a very expensive prescription and it arrives and the consumer believes that it's spoiled. Who pays for that? Is that the consumer's responsibility, or is that in fact the pharmacy's responsibility to make good on it? I know Representative Acomb, you mentioned that your husband had gotten a replacement, but is that just because out of the goodness of their hearts? Because if it's a very expensive medication, they might just say, well, that's your problem, prove that it's bad. Is that kind of where we're at?
Well, it is. Thank you, Madam Chair. I will say that, again, the proof is on the consumer to be able to prove that something had been, you know, held improperly. And so it was only because it was received in state on one day and not delivered to our home until several days later. And the temperature during that time, I mean, my husband had to go and prove to them in the weather to be able to make the case that it needed to be replaced. And so I think it isn't always an easy process. And I will say that most people wouldn't even know they needed to do that because it isn't readily available that these have temperature requirements unless you're told to store them in the refrigerator or whatever. And so I think that it's, as you said earlier, I mean, I think this really is a consumer protection bill. And so I don't know if Ms. Mack has anything to.
Yeah, and I would just say that it seems like, you know, let's not forget that ultimately the consumer really bears the risk, whether or not they bear the financial risk, because they're taking the drug and needing that drug, right? And if the drug isn't effective, or I don't know if it could, you know, there could be some other effect from it because of the temperature fluctuation, that of course is on the patient, right? So Ms. Mack, did you want to add something there?
Yeah, I just wanted to add that, you know, essentially that is going to be a conversation that the patient will have with the pharmacy that sent out the mail order pharmacy or the specialty pharmacy that sent it out, and they will discuss it. And, you know, that they'll talk about, you know, what does it look like, and ask a lot of questions. So I just wanted to bring that.
Yeah, well, thank you for that. I mean, if they know to do that, I guess, if they have the wherewithal to do that, I would gather and guess that many patients don't have the smarts and the wherewithal of Representative Acomb and her husband to do that. And we know that chronic disease and acute disease strikes often in people who don't have as much wherewithal, have lower incomes, and, you know, all kinds of folks. So I don't know, that it does seem like this is an area that needs some reform. So, all right, well, thank you very much, Representative Acomb. The bill will be laid over, and I hope that the conversations can continue. And if there's any tweaking of the bill that needs to happen, you know, please let us know. So thank you very much. The bill is laid over.